Welcome back and thank you so much for staying with us. Now, South Africa's COVID-19 infection rate is currently climbing again. And, well, government is actually worried. But now I'm joined by Professor Shabir Madhi from the School of Pathology at Wits University. Prof, good to have you as always. It is concerning not just government. I mean, if we're seeing a climbing rate of COVID-19 infections, it means there might be something we're doing wrong here. What could it be?
So good morning to you. So you're correct. Unfortunately, we are seeing a resurgence, which is not completely unexpected. And the main reason for this resurgence is because of complacency creeping in with regard to the behavior of people. In particular, the wearing of face masks, avoiding overcrowded settings, especially in closed, poorly ventilated areas, and not maintaining physical distancing. So in South Africa, despite the likelihood that a high percentage of people were infected the first time around, probably up to 1/3 of adults in major urban metro areas, the reality is that that level of infection is inadequate to prevent or to avoid subsequent resurgences if people are not adhering to the non-pharmaceutical interventions.
Professor Madhi, why are people not adhering to these regulations and health measures? Are they potentially pandemic fatigued?
Well, I think that might be it, but it might also be because we the first wave started to subside, that people became sort of more, that's what led to the complacency, in that people no longer perceived it to be a threat because the number of cases that were being reported to have died from COVID-19 and the hospital occupancy was being reported as sort of improving all the time. But again, I think that's sort of a misinterpretation in that sort of scenario is not going to persist unless South Africans play their part in terms of ensuring that the virus doesn't start spreading rapidly again. The virus is going to be with us. This virus is not going away. It's going to come in waves. There's going to be resurgences, but all of that is largely dictated, as is currently also the case in Europe. It's largely dictated by the behavior of the citizens of the country.
Right. I mean, as we speak right now, this total, as far as infections are concerned, or that we've recorded at least in the country, are sitting at 732,000. But when we break it down to provinces, which provinces are seeing the most threat when it comes to this resurgence?
So the resurgence currently seems to be worse in the Eastern Cape. They seem to be having a fairly rapid resurgence, much quicker than perhaps what's even happening in the Western Cape. But what we're also seeing in many parts of the country is that there is sort of an upward creep in terms of what is called excess mortality, which is reported by the Medical Research Council. But it's important to understand when the Medical Research Council reports on excess mortality this week, the data they're actually referring to are infections that probably took place at least 4 weeks ago. So the type of resurgence that we're seeing right now in terms of what is materializing as hospitalizations and excess mortality, these are infections that took place probably 2 to 4 weeks ago already.
Right.
Now, one of the challenges we face is that because we're not doing enough testing in the entire country, we're simply not able to identify these resurgences in real time. And that is a concern as well.
Yeah. I mean, medically, as a medical profession, what would your advice be in terms of whether or not we should be moving to a hard lockdown again or not? I know most South Africans do not want to hear that. Cabinet is still obviously going back and forth on whether that should even be an option, with rumors of the president potentially addressing us next week. But from a medical perspective, what's your advice then to Cabinet?
Yeah, in a South African context, there's close to zero value in terms of going to higher levels of lockdown. It's not going to achieve anything different medically and in terms of controlling the epidemic relative to people actually adhering to these recommendations in terms of how to reduce the rate of infection, the wearing of face masks, the physical distancing, the minimizing of overcrowded situations. So going to higher levels of lockdown is not going to assist in that. Because even during the level 5 lockdown in South Africa, there was still ongoing community transmission. And all that the lockdown really achieved in terms of the epidemic was to sort of move the epidemic outwards into 3 to 4 weeks into the future. So the number of infections that occurred in South Africa would have occurred irrespective of whether we had a lockdown or not. The only difference is that our healthcare facilities were better prepared because the lockdown bought them time in terms of preparing the facilities. But now that the healthcare facilities should be prepared, that's not a reason to go into a lockdown anymore. And we all know about the impact that the lockdown has had on livelihoods of people, on the economy of the country. So that is not an option for South Africa.
All right, Professor Madhi, always good talking to you. Thank you so much for your time.